There's been no let-up since the first case of COVID-19 was reported in Latin America at the end of February. 5 months on in Buenos Aires, these ambulance workers mourning the death of one of their frontline colleagues. The number of registered infections in Argentina has passed 400,000. It's a similar story across the region. In Peru, these health workers marched to demand better working conditions. Peru has just overtaken Belgium as the country in the world with the highest number of deaths per head of population.
More than 9,000 workers have been infected due to the lack of personal protective equipment. More than 70 health workers have died.
Lack of adequate investment lies at the root of many of Latin America's problems. The inequalities only highlighted by the pandemic, with health workers often hit particularly hard.
I was a COVID patient. 49% of my lungs have been affected. As an employee of the affected institution, I've still not been paid compensation.
Each country has tackled the crisis in its own way. Some, like Peru and Argentina, with strict early lockdowns. Others, like Brazil, emphasising the economy over health. Brazil has just registered 120,000 deaths from the virus, second in the world only to the United States.
In far too many places, there seems to be a real disconnect between the policies that are being implemented and what the epidemiological curves tell us. This is not a good sign. Wishing the virus away will not work.
Economies showing tentative signs of recovery last year have been devastated by the pandemic. The already vulnerable, like these street vendors in the Colombian capital Bogotá, now barely surviving.
Days that we don't work are days that we don't eat and don't have enough to pay for utilities or anything at all.
Many countries in Latin America believe their rates of infection will be peaking around now, and they begin dreaming about the end of the crisis. That's not happening. The nightmare only continues. Schweimler, Al Jazeera, Buenos Aires.